You may have heard the saying, your zip code is more important than your genetic code. We've been very attuned for several years now to what we call the social determinants of health. Transportation insecurities, food insecurity, economic insecurities, safety in the home. One of our goals is to be where our patients are. We just opened up a facility in Maryville last year for that exact reason. 250,000 people in that area. Telehealth and virtual visits have become sort of a leveler. So suddenly people now have easy access to our system. By incorporating those social determinants and providing that care to our community, it has a blanket effect. When I see everybody embracing it with their devices or their borrowed devices, and they're doing amazing at it, it's been very rewarding.
I got a book for us to read.
A key role in any healthcare system, and especially at Valleywise Health, is education of the entire family and the importance of healthcare and their healthcare needs. Through the Family Learning Centers, we're able to connect with all members of the family, understand the importance of early education that will lead the children to be successful.
The Family Learning Centers are an information hub located within the Valleywise Health clinics. We provide resources, we provide educational classes, parenting classes, and medical information as well. As soon as COVID-19 numbers surged in Arizona, our locations were closed. Since then, we have launched virtual online classes. We have conducted a weekly newsletter with information, virtual story time as well. We have noticed at the Family Learning Center that our families at this moment do have many needs at this time, and we are really supporting them, I think, more now than ever.
And Valleywise Health is trying to make sure everyone knows what's going on and what to do during the pandemic. That specifically includes refugees, because many of them don't speak English.
Arizona historically has been a leading state hosting refugee new arrival. And there was a great need in terms of creating a patient-centered medical home for newly arriving families that had not existed before. And so when I arrived in 2008, I was able to share this vision with our leadership. They helped me create that space to grow a center such as what we have now. Over the past 12 years, we have truly grown to be able to serve women from over 59 countries across sub-Saharan Africa, Southeast Asia, and the Middle East, as well as really create a unique model of care that builds trust with our refugee patients and families and helps to break down some of the barriers to care and navigating a healthcare system that is unfamiliar to them, Western medicine, preventive health, through our cultural health navigators. These are women who have a shared cultural and ethnic and linguistic identity with the communities that we serve. We are truly leading the charge in terms of creating safe spaces for families to receive quality care that's linguistically and culturally appropriate. You can imagine for newly arrived refugee families, English is not their first language, and often for our women particularly, they may not have had educational opportunities to go to school. And so what's novel is that we use a lot of audiovisual modalities to convey health information. And a perfect example is what we've done to respond to this COVID-19 pandemic crisis. You have to often think of novel and innovative ways that you can engage communities that are otherwise underserved, hidden, or would not be able to receive the necessary outreach and education or information, especially when we're in such a pandemic crisis as we are in right now.
No matter what language you speak, no matter what your socioeconomic background is, we want you to be part of these technologies. We're working very hard to enable all of our patients with these virtual options. We want to make it super easy. It's something that's for our patients. They're getting benefit from it and they are loving it.